The new treatment for heart attacks could help local patients recover much quicker.
Our Dr. Joe's here now with a sneak peek at how it works. What's going on, Joe?
Well, John and Kelly, you've heard that stem cells can do amazing things. Well, now researchers at Pepin Heart Hospital think they might be able to use those cells to help mend hearts damaged by acute heart attacks. 46-year-old Hatem Faraj is one of those patients. He recently had a severe heart attack. So earlier today, a team from the University of Florida took samples of bone marrow from his hip, took the cells up to Gainesville for processing, and harvested stem cells from it. They plan to take those stem cells and inject them into his artery and then into his heart. Now, experts believe patients who have heart damage might be able to build new muscle with the help of those cells. And patients like Hatem say they couldn't be more excited.
This is the future. I believe this is the future. This is where somebody can come in with a heart attack and they can treat them right away.
We hope the cells work, their regional function gets better, and they recover what ordinarily would turn to scar. And if that happens, then you'll see this therapy become standard therapy.
Right now, researchers at Pepin will be working with other local hospitals to see if there are any other heart attack patients who qualify. Now, there have been some issues in previous studies where new muscle created by the stem cells didn't function as well as the rest of the heart. Although doctors today say they don't know what the outcome of today's study will be, they say they're optimistic. Kelly?
All right, Dr. Joe, thank you.
A story now about stem cell research, not the kind often debated in political circles, but a life-saving procedure that could help heal damaged hearts. Bay News 9's Melissa Eichmann talked with the first local patient and shows you the procedure while the doctor performed it.
A heart attack 2 weeks ago left 46-year-old Hatem Faraj's heart severely damaged. Now he's part of research that will use his own stem cells to actually regrow damaged heart muscle. We caught up with him before today's procedure.
And I thought maybe this is the future, and I wanted to be part of it.
Pepin Heart Hospital in Tampa is one of only 5 sites studying the procedure. Our cameras were there for the first one here.
It could save a lot of lives.
Dr. Charles Lambert says the stem cells are harvested from the patient's own bone marrow and infused back into their heart. You can see him inject millions of cells into Faraj.
The idea being that those cells may incorporate into the myocardium, the heart muscle, and improve cardiac function, restore it back to normal, whereas usually that tissue would just turn to scar.
Faraj says he's confident about the new approach.
Hoping a lot of people benefit from this because heart attack is it's scary. I mean, it could end your life just like that.
Again, this procedure is still in the clinical trial phases, meaning it is not available to the general public. Dr. Lambert says he'll be monitoring Mr. Faraj at least for the next few years. In Tampa, Melissa Eichmann, Bay News 9.
Dr. Lambert tells Melissa the patient can go home tomorrow. He also says it will take a while for the cells to grow. It will be a year before any results can be reported.
You're watching ABC Action News with Wendy Ryan, Brendan McLaughlin, and your AccuWeather forecast with Dennis Phillips.
Welcome back. A local man is about to undergo a heart procedure that's never been done in the Bay Area. It involves taking stem cells from his hip and placing them in his damaged heart. Our Serena Fazan is live at Pepin Heart Hospital in Tampa. Serena, this sounds like science fiction, but it's just amazing.
It is amazing, Brendan. It is huge because if it works, heart attack victims who potentially have no chance of survival could have a second chance at life. Hatem Faraj suffered such a massive heart attack, doctors say his chances to live are as low as 20%. But this 46-year-old can't stop smiling.
I feel I got another chance after that heart attack, and I'm going to try to do the best I can with it.
The father of 4 agreed to a clinical trial in the first stages of research. Doctors will infuse stem cells taken from his hip into his heart. Dr. Charles Lambert, Faraj's physician, explains why this would give him a second chance at life and why it could be a medical breakthrough.
If they're given the right signals, can turn into any type of tissue in your body. So you could take a stem cell, and if you could figure out how to turn it on, it could become a brain cell, or it could become a hair cell, or it could become a heart cell.
But because this is a pioneer trial, Faraj may not even receive his own stem cells. There's a 30% chance he will get a placebo. The reason for that is because doctors do not want the power of positive thinking to influence a patient's potential recovery.
Is that fair to the patient, do you think?
But the patients are fully informed of all this. That's why I'm saying It's difficult to recruit these people because they have to be interested in real medical research. This is not play medical research. This is real.
For Faraj, it's a chance that he is more than willing to take.
I'm thinking this can help me down the road. I mean, it will help other people. You know, I think this is the future.
Certainly could be the future. Faraj right now is undergoing this procedure, and doctors don't even know if he is getting the placebo or the stem cells. They'll learn that later on as the trial proceeds. At this point, we don't even know if it works because only a handful of people in the country have had this done, and it is so new. Reporting live at Pep and Heart Hospital, I'm Serena Fazan, ABC Action News.
Thank you, Serena.